a re-examination of whether that patient really needs more service or not. And we've got some results back from the Center for Medicare and Medicaid Services that in fact a lot of overutilization has gone down by a significant percentage, but most importantly, those patients who really need the extra care are getting it. And one argument that I think always is persuasive is, we know what's best for our patients, let us do our job, and don't have these arbitrary caps from Washington, which really have no basis for each individual patient and what their patient needs are. And then, that's been a very persuasive case. We've had a second line of attack. Some of the skilled nursing facilities, nursing homes, would like to get control over our payment structure, and we've had to fend that off, but there's no need to get into the details of that. But it's been quite a battle to try to keep your independence so you can work with patients without interference from nursing homes and others. I'll stop there. One thing I'll leave you with is, as they're talking to congressmen or their staff on the committees, or senators on the committees of jurisdiction, so that's Energy and Commerce and Ways and Means Committee in the House, and the Finance Committee in the Senate, you'll find a higher degree of sophistication and understanding. And the highest degree you'll find is with the committee staff. So as some of you are meeting with them, they may have really in-depth questions. I always found the best answer is, if you don't know the answer, say, we'll get back to you. I don't know the answer to that, rather than trying to speculate or make something up. It's okay if you don't know the answer, and make sure you circle back with Chris and Tim, and then we will come back and I will help these guys come back and try to answer any technical questions they may have. No one expects you guys to have a technical understanding of the payment system. What they do expect you to have a real understanding and appreciation of what it takes to take care of these patients. And to the degree you can convey that and what your challenges are with that, the better off we are in conveying the public policy messages. So they have a full appreciation of what it is you're doing.
John, can I ask you, what's the, when you had a really good visit, when somebody came in and they were really affected constituents, what did that visit look like?
It was always effective for someone to say, I'm an occupational therapist, or I work in a hospital, and here's a typical day of what I do. And then talking about how that then relates to the issue that you're flopping on. So for the therapy cap, many of my patients are very frail, and I know an arbitrary limit on how much care I give them makes absolutely no sense, because where would they go then? What would happen to them? And then have a few examples of the type of patients. So you get away from the theoretical, you hear a lot about Washington, and more on the hands-on. They had this particular kind of ailment. I was providing this kind of therapy. And then in September, I was told they couldn't get any care for me. That would make absolutely no sense. So to the degree you could use your own personal experiences and translate that into the policies you're working on here, that's the most effective way, particularly as you make that constituent vote.
Thank you, John.
Thanks for coming.
John brings up a good point. A lot of people will be familiar with occupational therapy because of the therapy cap. And you don't have a handout on that, but please tell them that it is critically important that as John said, your clinical judgment remains to be important, the driving factor in deciding whether somebody gets therapy or not. Any other questions? We're waiting for Heather. What I'd like you to do is, one of the things that I find staff like is for people to be not abrupt, but quick. If you're going in with a group and you want to introduce everybody, do it as quickly as possible with your name and maybe the town where you're from, as John said, whether it's your parents that are the connection to that particular member, or whether it's a hospital that you did field work in, or whether it's where your school is. But be quick as you're going around the room, and when you have a big group, try to decide ahead of time who's going to be the main speaker. or speakers on the issues. And then watch your time, because they will be watching their time. You'll see them looking at their watch, and that's absolutely, totally normal, because they've got appointments backed up, especially on a week like this where there's so much going on with regard to financial services issues. People are going to be very busy going to briefings, having meetings, and informing their members of Congress. But before we have Heather come in, I want you to think about that. Ask me about OT, what you say, and I want you to turn to your neighbor and try out your introduction. Yes, I'm an OT, and OT is. Just turn to a neighbor. Let's see, everybody go to their right. Everybody go